Hello and welcome to the CCO podcast. I'm your host, Zachary Schwartz. In this episode, we hear from Dr. Sonal Kumar and patient advocate Maria Morais to discuss actionable steps that healthcare providers can incorporate into their care for people with PBC. To learn more about our faculty, see the links in the show notes. Now let's get started and hear from Dr. Kumar.
Hi, everyone. My name is Sonal Kumar. I'm one of the hepatologists at Weill Cornell Medicine in New York. I'm here with Maria Morais, a PBC patient and a huge advocate for patients with PBC, to get her perspective on actionable items for us as healthcare providers for our patients with PBC. Maria,
Thank
can you tell us a little bit about yourself?
Thanks, Sonal. It's great to be here. Always wonderful to talk about the patient perspective, especially trying to impact and share lived experiences of PBC patients with healthcare providers. As a patient myself, having experiencing different symptoms and proceeding to having a transplant, a liver transplant in the last 3 years, it's really important for me to share not only my perspective of what it's like living with PBC, but as a patient advocate, volunteering my time with the Canadian PBC Society and having a lot of insight into what matters to PBC patients and in particular, what matters to them in respect to how they want to engage and interact and receive quality care from their healthcare professionals. I'm really happy to be here and discuss, mutually how PBC patients as well as healthcare providers have a shared experience to come up with what we're calling a very individualized plan because of care. Because as PBC patients, we all experience this disease, this rare liver disease in unique ways, yet there are commonalities. So I'm looking forward to having this discussion.
As providers, we often focus on the number when it comes to patients, FOS number, and that's how we judge success or improvement, but that's not what the patients may feel. I mean, obviously they want to preserve their liver function too, but that's where I would love to hear, what's important to you, not beyond just the alk-phos level or the fibrosis stage, because, this is PBC is unique in the sense that it is a disease that has symptoms as opposed to a lot of other liver diseases. So I think as hepatologists and gastroenterologists, it's really important that we recognize that and address that.
There's the clinical markers and improvement, once therapy starts, but it's also what's important to the patient is how am I feeling? How am I planning my days? Am I going to be, I want to go out with my friends and that social aspect of maybe it's a late evening. Am I going to preserve my energy? How am I feeling in terms of, am I going to be able to go out and being more like socially isolated and feeling defeated if, you can't make it. So the goals for the patient is really about feeling more energized, managing that itch, being able to make decision making because of the cognitive impairment, perhaps.
Even when we think about symptoms as providers, pruritus is always the first thing that comes to mind. But now that I've actually been more cognizant of how I'm approaching my patients, it's not pruritus that's the biggest issue. It's more energy level and fatigue. And I think we don't do a good job about pruritus, but we do an even worse job talking about energy and fatigue and how do we address this and how do we assess it? And then what do we do to make sure that we can hit those goals that you have to be able to go out at night, to be able to do the things that you want to do. And it's so tough. I don't know. I don't have a good answer for that.
Yeah. So with some of the patients, we talk about and they talk about compromise. So making sure that, as they plan their day, and if they have one thing or two things, looking at what's going to be priority and what are they going to have enough energy to be able to accomplish that task. Or, it could be even a task of grocery shopping, right? You're on a grocery shop day, you need to go out. So what do you need to do to preserve energy. So it's really, there's a lot of planning involved. Say you have a social event, but then you come to that day and you start making excuses like, I'm going to back out. I'm not feeling up to it. Or if you go to that social event, you know that you're going to be even more tired after. So to be able to clear your calendar, or who's going to look after your family the next day if you go to that wedding or that, night out or whatever. And so a lot of compromises have to happen from the patient perspective.
And do you see anything as providers that we could do differently to help acknowledge that, to help address that, assess that? I just find it to be so difficult. Like, there are no good tools to assess fatigue. There's no one specific question. How do I hone in on these issues that you may be having as a patient when you come into clinic?
Yeah, I think first and foremost, there has to be a trusting relationship, forming a relationship where the patient goes to the healthcare provider and is feeling comfortable to bring forward any and all symptoms. I don't think it's up to the to the patient to say, okay, these are all, related to my PBC. It's not the patient's role. It is the physician's role to listen and be open to asking questions in multiple ways that demonstrates, as a healthcare provider, I'm here to help you. I'm here to listen to how you're feeling. So the healthcare provider could have strategies of asking the questions in multiple ways to elicit the information. So, for example, if the bilirubin is up, rather than talking about bilirubin, ask the question about, are you feeling tired? And opening up the conversation that way so that the patient feels like, okay, like I have noticed certain things and I'm just going to bring those up.
Yeah, actually, one thing I started doing since we started hearing patient perspectives and from advice from you all, one of the things I started doing at the end of each visit, I tell a patient to make sure to write down your questions between now and the time I see you next, and just keep a running list about changes in how you're feeling and anything that you think may be pertinent to let me know. And I just yesterday had someone bring in their list, and it was nice. It was actually, we spent very little time actually talking about biomarkers. We actually went through the list of how things were progressing, not progressing, how things were changing, how day to day. And it was actually a very eye-opening experience for me as a provider. I think it was really nice. And it worked. It worked really well. I like it a lot.
I think that's really ideal, that for patients to be acknowledged, that, the healthcare provider could say, that's really helpful that you're bringing in your questions because it helps us keep focused on what is top of mind for you today. PBC is a long journey for many PBC patients, right? I mean, for me, my PBC symptoms progress rather quickly, but for many, many of our PBC patients, it is a very long-term, progressive, chronic illness that can be well managed. And it's really also about healthy lifestyles and wellness strategies that the healthcare provider can also encourage, right? So physical activity, eating well, having positive mental health and outlook, socializing, building social connections, and really talking to other PBC patients and just sharing stories and telling our stories to be supported. There are common symptoms, and the fatigue, I would say, is a very strong, and especially knowing that this disease hits, a lot of women in, that midlife where, is it just menopause? Is it coupled with menopause? These symptoms that they can be very vague with other things happening. And, we have busy lives. We're taking care of maybe children or grandchildren or our parents.
Right. Yeah. I mean, I think, one of the hard parts about PBC is that the symptoms are not very specific to PBC. It can be just life. It can be the other autoimmune processes that are going on. It can be PBC, or probably a combination of everything. And it's sometimes hard to isolate what is the predominant factor playing a role, but most likely I feel like everything's interacting with each other. But I think you bring up a really nice point about we also need to do a better job about just talking about lifestyle modifications that can make a difference in energy level. And, not everything necessarily needs a medication, and a lot of things that we can change about sleep hygiene or even a little bit of difference can help, because it all adds up.
Yeah, I think you're very right. One of those actionable items from a healthcare provider is that, prescriptions for healthy lifestyles, recognizing that there's also a lot of additional adjunct measures that can also be helpful. Sleep is a very significant complaint among PBC patients, lack of appetite sometimes. And so ensuring that as patients, we are also taking care of our inside through appropriate food. And we need to be reminded of that sometimes. And it may not be the physician. There's other healthcare providers, there's nurses, there's in clinics, and dietitians perhaps.
Yeah, absolutely. Actually, we're at Cornell, we're really lucky because we have access to dietitians that are complimentary to patients, so they don't get charged for it. And I actually have not yet put my patients in touch with dietitians. I do it for my MASLs, my fatty liver patients, but I think this is a great idea that I should actually have my PBC patients also meet with a dietitian, at least for a consult, to sort of get, some suggestions on how they can maybe make some dietary modifications to help their liver. I think, it's hard with PBC being a rare disease, and a lot of the patients are still within the gastroenterology practices where they maybe see one or two patients in their entire practice with PBC. How do you think we should sort of try and rectify those gaps in knowledge? A lot of GI providers may not be as familiar with PBC and how we should be addressing symptoms, or even the new medications that are coming out and getting approved. The majority of them are still out in the community.
Yeah, I think that's still a real challenge. So when I go see my doctor, it should be all about me. And I should not have to educate my doctor on, what to do.
Right.
But we also know that there's a lot of complicated diseases out there. And if they are rare, then it's even more difficult.
One of the things I always say that's nice about PBC is that you really have a close-knit community, and there are a lot of resources. So anytime I diagnose someone or have a new diagnosis, or even an old diagnosis of a patient with PBC, I always refer them to all these support groups, because I think that's a huge asset. And one of the best, aspects of the PBC community that's very unique as opposed to other liver diseases. And I think all the resources that are available, not only from, an education perspective about the medications and trials and all of this stuff, but I think even more importantly to, like you said, Maria, to share your experience, but recognizing that each person has a unique path and a unique symptom burden, and, how it affects their life can be very different. But just, it is a rare disease in order to feel that sort of camaraderie or acknowledgement that it's real and what you're feeling is real, and it's nice to have each other. I am always pointing my patients in PBCers or, any of these groups, because I think they're great. And I have never had anyone come back and say, no, this was awful. Everyone's spoken very highly about these.
Yeah. Yeah. I mean, as patients, one of the things we're told is not to go online and Google information, right? And sadly, some of the information that is still out there can be detrimental, can be anxiety provoking. It's not, not always credible sources. So being connected to official support groups, societies, foundations, many of the, as an advocate, I've been connected to at least 7 patient groups, advocacy groups internationally, which is fantastic to hear about. So we also have to do better to promote that there's these foundations, societies, and groups, advocacy groups, where there's space for patients to have that sense of belonging as community and shared experiences of PBC, where they're not going to get that, just connecting with the healthcare providers. Unfortunately, I became very ill with my PBC disease where I had to be transplanted during COVID. And I tell you, it was really, really challenging because I was isolated. And then post that, I started to connect with other communities, PBC patients that had transplant, which is very small, but I was so grateful. And we talked about just PBC in general. And it's just the everyday support from people that are experiencing the same thing.
Yeah, I think these support groups offer so much value to patients. And, I think, now's an exciting time for PBC with these new medications being approved. And, maybe it's a nice time to bring that to the forefront too, as we talk about new medications, even just becoming more aware of these resources as providers, because I'm sure a lot of providers aren't aware of what's out there. Maria, they're new. Obviously, I'm sure, pretty aware of the new medications that are being approved. So there's a lot of discussion around, altering therapy. And I'd love to hear, your perspective on these new medications and how how you see them fitting in to entire picture of PBC for yourself and other patients, and how we should be having these discussions with you, especially as now there's some indication that these may be helping with symptoms as well.
Yeah, I think for PBC patients, the time is really exciting with new therapies coming out. The first line treatment, certainly from what we know, is not working for everyone to lower liver enzymes. For a long time, there haven't been a lot of options other than second line therapies, which may not have been sufficient enough. So knowing that there still is unmet needs for PBC patients in terms of other symptoms that are quite impactful, such as the itch and, fatigue. I'm not sure that we're solving that issue yet, but everything kind of goes hand in hand. If I'm itching less, which was one thing that really, really I suffered from, and with insufficient response to the medications that I was treated with about 3-4 years ago, it impacted my sleep. If I didn't sleep, then it impacted myself as, a professional and in my work life and being a mother. Any new medications that are coming out that are proven, that are and approved, as a PBC patient community, there is lots of excitement. So I'm online with different, online platforms where other PBC patients, around the world. And so people are asking each other, how do I get this medication? I heard about this. And so there's a lot of excitement and anxiousness to want to, how can I get that? How can I get that for myself? Yeah. So a lot of individual advocacy and taking that information back to their own healthcare providers, who then need to be knowledgeable.
I think it's such an exciting time. And I do, see patients who come in asking about the new medication, or they've heard about the new medication. And I think maybe as providers, we focus on the biochemical markers. But I think when we talk about these new medications, one of the things that we should also address is the impact it potentially could have on symptoms and quality of life, which is equally important. It really it all circles back to this personalized care that you mentioned earlier. I think we're really moving towards that. And I think the medications, the emphasis on quality of life, all of these things allow us to really focus holistically on the patient and really personalize the care. And it's nice to understand or recognize that it's not a one size fits all or one algorithm fits all anymore. We're really shifting the paradigm of care in PBC. One of the things as providers that I like to do with my PBC patients is actually not start by talking about the biochemistries. I actually end with that. And I start off with open-ended questions about pruritus, fatigue, quality of life. And I spend the majority of the time talking to the patient about that and allowing our patients to sort of share whatever they want to share or go over that list that they may have. And so I sort of switched my model of how I talk to patients. I used to focus on the liver part of it first, or your ALK phos was this last time, it's this that time, or we'll check it this time. This is what your FibroScan looks like. But I try to leave, just 5 minutes at the end for those questions. And sometimes there's nothing to address from the patient perspective, but at least I don't leave that to the end. And so I like to not feel rushed when it comes to addressing those type of symptoms.
I think that's really great of you to have that. From my perspective, it would be really important and neat to go into a doctor's office and that it feels more relaxed, that I'm going in being asked, how are you doing, right? Rather than, here are your numbers. There's not a lot of hepatologists, so they're in high demand. And so their clinics are very, very busy. So I've heard a few stories where patients have to travel 4-5 hours remotely to go to these hubs, patients that are already feeling really exhausted. And so when they actually get in to see the healthcare provider, they're already feeling really exhausted. And so for that healthcare provider to say, how are you doing? Allows that openness. And, that patient could say, it's been a long journey and I'm really excited to see you. And I've been waiting 4 or 5 months for this appointment. And so that patient walks away with, I'm feeling cared for. I was able to describe, how I'm feeling, my symptoms. The feeling is your symptom description rather than, I'm not feeling like my numbers, my liver enzymes are up or down or sideways. I don't care about that. I care that you're listening and you're saying, okay, well, I have some information here that might explain why you're feeling this way. So validation, I think, for the patient.
One of the things you brought up is coming with your care partner. How do you feel about us asking questions to the care partner as well? Sometimes I think the care partner may provide valuable information that the patient may not recognize or may have difficulty remembering or whatever it may be. But obviously we want to make sure that the patient is in sort of, the main point of the visit. So I always struggle with this a little bit. What are the patient's perspectives on that?
I think a lot of patients value having someone with them to support the patient in the moment, not necessarily speak for the patient, but I think have an open communication with the healthcare provider and that the healthcare provider can acknowledge that this person is in that role of support. And what has been helpful to me when I have somebody with me, I don't always, but if I'm feeling like in a stage where, I'm exhausted, I've been not sleeping, maybe, I'm not going to understand maybe it's a critical meeting appointment, to have a second pair of listening ears that then the patient can walk away and say, okay, can we debrief? What did you hear? This is what I heard. And the patient has a lot of emotion and coming in with a lot of stress and is dealing with the disease. Whereas the care provider or the support person can be a little bit more neutral and say, well, this is what I heard, and these are the notes that I took for you.
Talked about a lot today. If you had to pick the top 3 or 4 things that we should do as healthcare providers to make your experience better during our appointments and more valuable and hopefully have an impact on everything for you as a patient, what would you say the top 3 or 4 items are that we should change in our practice or implement in our practice?
Yeah, so I think what we discussed today, we discussed a lot, but I think going forward as maybe recommendations for healthcare providers in the way that they can provide their care is to maybe switch things up and try different things with different patients. We're not all the same type of patient. Some ask more questions, some, are very quiet. So I would think encouraging your patients, during the symptom assessment phase, that you're making sure that you're pausing and asking questions of the patient you're asking about fatigue, which seems to be one of our major complaints. Fatigue, itching happens to a lot of us, but trying to assess that. And then any other general sort of thinking about the physical, social, and mental well-being sort of buckets of questions, and making sure that you're addressing those and asking questions, and maybe encouraging your patients to write down their questions for next time, recognizing that you may not have, that appointments are limited. And so what is top of mind for your patient that day, but to encourage for next time. I think in terms of recommendations for looking at medications, ensuring that your patient is understanding and making sure that your patient is taking their medication, if they have any questions about the medication, or if there's any side effects that they're experiencing. And as you're looking at their biomarkers, are there any changes that you want to engage on medication, and making sure that you're explaining exactly why those changes. And I think lastly, just encouraging your patient to also, seek support for support groups that are out there with other patients to share their experiences. There's a lot of value in that. And perhaps you can also assist in other referrals to, say, a dietitian, or, to spend time, if you have a nurse in your clinic, to spend time maybe talking a little bit more about specific questions your patient might have. And then general lifestyle changes that can be encouraged, so that patients can start to think about how they can incorporate different tools or strategies in their day to add to quality of life.
Yeah, I think these are all reasonable changes and not anything dramatic that we can't incorporate in our practice. It just involves a little bit of tweaking. So I think this was really exciting discussion, and I hope to implement a lot of these changes in my own practice as well. So thank you so much.
You're quite welcome. It was great talking.
Many thanks to Maria and Sonal, and many thanks to you, our listeners, for joining in. To learn more about this program, see the links in the show notes. Thanks so much, and we'll see you on the next podcast soon.